This is Pet Life Radio. Let's talk pets.
Let's talk about pets, baby. Let's talk about ticks and fleas. All the fun things that we see. Smart tips and tricks guaranteed.
All right, welcome to Let's Talk About Pets. Two different versions of baby. There are two kinds of people in this world. Chaotic, and then, pretty. I was going with chill, but I thought it sounded pretty. Oh, thanks. Today, we're going to talk about vaccines. Ooh, actually, I kind of wanted to start this out with a joke about a dog with rabies. Okay. And then I was like, they won't get it unless they get bit. So. Get that? Because it spreads through spit. Right. Yeah, that's She was like, I got this great joke to tell you, but I'm going to wait till the podcast. I worked on that with Grace beforehand because I have friends. I definitely have friends. And she was like, yeah, it needs a little bit of work. And so I feel that was after you worked on that. I tried a knock-knock version that went worse. So I have to hear it now. Oh, it literally is just, I can't, I'm embarrassed now. It's knock-knock. Who's there? Rabies. Rabies who? You don't get it unless you get bit. So I like that better though. Yeah. That one to be thumb. Like, I should never bring it up again ever. No, that one was funnier. That was the better version. I like the other one because I'm like, I want to tell you this great joke about a dog, except for you're probably not going to get it unless the dog bites you. I like the knock knock because it gives you suspense. Right. Like, I was like, oh, who's on the other side of the door? It's the rabidus. The rabidus. The rabidus. We don't want the rabidus. We don't want the rabidus. So we'll talk about all of that today, but we're going to start with our famous reviews. We are going to start with a post from a mom group. Okay. My daughter's dog wandered across the road, and we just got a letter from animal control for animal at large, in quotations. He isn't registered. We have 8 dogs, and none are registered because we don't do rabies shots. This letter is now saying the dog has to get registered and get his rabies shot. I guess I have to take him in. If animal control comes to the house and sees all my dogs, they will require all of my dogs to get the shot. I'm upset because all of our other pups stay in the yard. We live in the country on the corner on 33 acres. I really don't have to do the rabies shot, but I don't know if I should fight this. Maybe the person who called thinks the dog is loose, but really he's on my property. Should I just take him in for the shot and then do a detox? I'm so upset. I'm looking for some suggestions and some ideas of a collar that can keep them within a radius of the yard. I have a huge fence already, and he jumps over it. So, I have one thing I want to point out about this. She lives on 33 acres. That's a lot. And it has a fence around it that this dog can jump over. So if this dog can jump over a fence, then maybe a wild animal can jump over the fence. And she doesn't think her 8 dogs, need rabies because they don't leave her yard of 33 acres, which is basically like the wilderness. Yeah, an entire forest. Your yard is a whole. Your yard is, and there's probably a good coyote out there hanging out, waiting to bring you the rabidus. The rabidus. Remote is French for rabies. What I don't understand is why she said that she needed to detox the dog. She's like, should I just get the shot and then detox him? I'm curious about what detoxing a dog after a vaccine entails. I mean, do you know those black foot stickies that you put on the pads of your feet to detox the chemicals out of your body? And there's these little weird pads that you put on the bottom of your feet, and it's supposed to suck the toxins out of your feet. Ew. These are them, and they turn black when they suck all your toxin out of your feet. I don't know what they're actually is, like metals or whatever out of your body or something. Do you think this is what she's doing to detox them from rabies?
I don't know, but like, if you walk on the floor, like when they turn black,
that's true. I think you're supposed to, put the adhesive sheet on and go to sleep like the lady in the picture.
Oh, that makes more sense.
And then if you wake up and the bottoms are black, then it proves that you sleepwalk.
That's fun. We love having 30 acres and not vaccinating for rabies.
They're in the yard.
Most of the states in the United States require rabies by law. That's probably why animal control is on her.
This one is for Shot Vet. And it is a 1-star inside of a hurricane. I don't know what that symbol means, but they got 1 out of 5. Was an awful experience. This is by Fernanda, by the way.
Fernanda.
Placed the dog on the table and it collapsed. Obviously scaring the dog. Left without getting any shots. Would not recommend.
Wait, her dog collapsed on the table?
The table collapsed.
Oh, no.
I was confused when I first read it, too, because it's placed the dog on the table and it collapsed. And I thought, oh, my God, your dog collapsed before you even got shot. But no, the next sentence is obviously scaring the dog. So the table collapsed.
Oh, no, she put her dog up there and it fell.
Was it a Great Dane on a foldable, like one of those little foldable end tables?
I don't know. I feel like I need more information.
Yeah, she didn't offer much more than that. So I can't help you. This was this year. Are you guys good?
Obviously scaring the dog. I would think so.
Fernanda, are you and your Great Dane okay?
I know. Break a leg.
Also, what if it was a Chihuahua, though?
Had a long way to fall.
What if the Chihuahua collapsed the table?
Could you imagine being like one of our tables or something collapsing? That would be so embarrassing. I would just put,
I'm gonna go now. Like, I wouldn't even have words at that point. I would back out. Like, I see you backing out of the room. You don't see, no.
I was never I'm an illusion.
Okay. I have one more for this place in the same one.
Okay.
It's for the same place, and it's a 1 hurricane star. And it actually show up to a location when they said they would. I went to the Shot Vet location, and they never showed up. 25 people couldn't get their dog shots because they didn't show up. So this is like I guess Shot Vet is one of those places that just show up. And there's like a line of 25 people waiting at the assigned time to get these vaccines, and the clinic never showed up. Although it was just 25 angry people waiting to get
their dogs. Oh, I would hate to be those workers. They're like, where is the Shot Vet? It's like, your guess is as good as mine, buddy.
Or like, hey, while you're waiting on them, and they know they're not coming because it's like a whole gimmick, they're like, walk around and get some dog food while you're here.
Cool stuff. Get a shoe or something. We've got all these things for you. Okay. Love that. Love when people say they're going to do a thing and they don't.
It feels like as a business, you really want them to show up, because 25 appointments that you didn't show up for is like bad.
Yeah.
I'm surprised there wasn't more people from that 25 that were like, I was also there.
I was there too. I remember back in the day.
I remember that time that didn't come.
All right, so now we're going to talk about vaccines, which is actually called preventative health. Prevention!
Very similar.
We love prevention.
It's your favorite word.
It's my favorite word. So the goal of vaccines is immunity. Your body, or dogs' bodies, have antibodies, which are protective proteins produced by your immune system. And they attach themselves to antigens, which are foreign substances in your body, such as bacteria or viruses, toxins, and they tell the body to remove them. We have many things in our bodies, and I keep saying our bodies because most of the things in like animals is like similar to humans. So like it all kind of works the same, aside from like a select few things. But that's why I keep saying our bodies do this. The immune system is responsible for detecting and destroying foreign invaders. It kills virus-infected cells, and it develops an immunity by remembering the antigen for the future, which is pretty cool. I'm about to get super nerdy on you.
I love when you talk nerdy to me.
There are these things called B lymphocytes that originate in the bone marrow and then migrate to the lymphoid tissues, and they initiate an immune response. So they secrete a specific antibody called immunoglobulins, and they lead to destruction of like the bad thing. It's called phagocytosis. And that's when a cell eats a bad thing, essentially, which is pretty cool. But the B cells can also turn into memory cells, and they're trained to detect the antigen if it appears again. They identify antigens in the future because antigens have a unique series of amino acid antigen markers on the surface that create a unique shape. So the B cells, basically, they create their surface to be like a corresponding shape to the antigen. They recognize it and they can start an immune response. So our body is awesome.
Our body is awesome.
Or dogs' bodies, whatever. It was the same way.
I have also seen some pretty cool things happening in dog and cat bodies, which cats are like a whole different other thing altogether. They do things that you wouldn't believe their bodies do, I'd say. They also climb to some height that I can't reach.
So there are maternal antibodies that are passed from the mother to the baby via colostrum. And colostrum is milk that's high in antibodies, and it's right before and after birth where it exists. So the baby has to ingest it within 24 hours of birth, and it protects them for a short period of time, but it doesn't create memory. So it's short-lived, and the baby can become susceptible to disease when it wears off, which is why once they're a certain age, we start vaccines because the maternal antibodies start to wear off, and then we need to help them build their immune system.
Hey, so that's when we start vaccinating.
Okay.
This episode has a lot of singing in it, and I like it a lot.
Of course, also, I wanted to add one more thing.
Yeah.
There are many different cells, like, in the immune system. Like, it's not just the B lymphocyte. Like, there's so many different things that I could talk for 4 hours about it, but I wasn't going to, like, do that here. Mm-hmm. But there's lots of things that work together to create an immune response. It's not just the B lymphocytes, but those are the things that, like, can create memory, and it's important in this aspect.
Very, very happy to have B lymphocytes at this point.
They're good.
Yeah, they're good. Are we ready for our next review?
Yeah.
This one is for Vetco. It is 1 star, and it's by Joe. It is called Never Going Back Again, Waste of Time and Money.
Okay.
Stood in line for an hour before my car could be seen for a simple nail trim.
Your car is getting his nails trimmed?
I believe if this was a mistype and it meant cat, but also bring your car in for a nail trim.
Sometimes it needs.
Yes. Once I got to the counter, the girls already did not want to remove my cat from the carrier, so I had to do so myself. Once my cat was out of the carrier, they said they would not be doing the nail trim because he was stiff.
Oh,
The place is also very overpriced. Stick with your regular vet because all you get here is poor service and an unhappy wallet.
Was it dead?
I don't know.
Was his cat dead?
Did he bring his dead cat in for a nail trim? And they were like, we're not cutting his nails, he's stiff.
They're like, sir, he's in rigor mortis.
Actually, they would not get my cat out of the carrier. It would make sense if it was his car that was stiff, maybe.
Could you imagine someone be like, I just need a nail trim. We bring him to the back, and it's just like,
But that's awful. But I mean,
oh no.
As a groomer, I've had the experience of people calling to ask if I would basically mortician their pet to get him ready for like a burial or like a at-home funeral service type deal. And I would be like, I don't really want to do that.
That's gross.
They were embarrassed to like maybe have families see their pet, or maybe they just want like the nails clipped in a bath and stuff. And I just wasn't comfortable.
I could see that, yeah.
But in this case, that also would explain why the girl wouldn't get the cat out of the carrier. I had to get my own cat out of the carrier. Then she wouldn't cut the nails because he was stiff.
Why, like, if he's stiff and not gonna fight you, why would you not just do it yourself?
Because he didn't want to quick him.
Okay.
He didn't want to quick his stiff cat.
It's not gonna bleed.
I don't know. Maybe it was just frozen stiff with fear. Or maybe it was actually his car. I don't know.
Wow.
I couldn't even get that one out before losing it. I was like, oh, I'm just gonna flip when I say this next.
That is crazy. People are crazy. People are just like something. So, vaccines. There are 2 different types of vaccines in veterinary medicine. There's the modified live vaccine, which contains virus particles that have been weakened, so they're non-pathogenic, so they don't cause disease, but they still are recognized by the body as an antigen, so the body can see it, create memory, and whenever it sees the real deal, it's like, we've seen that before, so not gonna allow that. There's also the killed vaccine, which contains particles that have been treated with heat or other methods to render them inactive, but the immune system can still recognize it as an antigen. Neonates, which are babies, they have to be a certain age to get vaccines. We normally recommend like 6 to 8 weeks. It depends on your veterinarian. But if you give them too early, the maternal antibodies, they limit the body's ability to have an immune response. So at about 6 to 12 weeks of age is when neonates are considered able to have an appropriate immune response. So this is when we start vaccines. There are multiple factors that determine how long immunity is produced by the mother, like to the baby. So we don't know if it's 6 weeks or 12 weeks. It depends on how much of the colostrum was taken by the baby, the concentration of antibodies in the colostrum, how fast the puppy or kitten breaks them down. So because of this, we have to give booster vaccines to puppies and kittens every 3 to 4 weeks until they're 16 weeks of age to make sure they're able to have an immune response to the vaccine. There are 2 different kinds of vaccines in veterinary medicine. There are some that are considered core vaccines, and there are non-core vaccines. So if we vaccinated every animal for every single vaccine that we had for every single disease, your dog and cat would be getting like 20 million vaccines. So there are core vaccines that are recommended for all animals of that species, which means that it's more common that they're going to run into this disease than like other things. So non-core is not recommended for every animal. It is only recommended for animals at risk. Some examples are like, if your cat is an outdoor cat, then it might run into feline leukemia more commonly than an indoor cat would, because indoor cats, they normally are just like around the things that are inside. So you have more control over what they're introduced to. Instead of like outdoor cats, they come into contact with like random cats and animals and things like that. So there are 2 core vaccines for cats and 2 for dogs. One of them, for both of them, is like a combination vaccine. So it has like several different like things in it that protect against different diseases. So for cats and dogs, both core vaccines for cats and dogs is the rabies vaccine. And then for cats, FBRCP, which we'll talk about what the heck all those letters mean. And then distemper parvo, DHPP, is the other core one for dogs.
I do have a low bubble question.
Mm-hmm.
I know you were saying some are not common core vaccines, and an example of that I would assume would be something like the rattlesnake vaccine, right?
Yes.
Now, I also heard that in some places, especially prone to areas with rattlesnakes, they issue, as long as the dog has dew claws, they do not, they're not affected by snake venom the same. Is this true? Or is this an old wives' tale? I have it.
I feel like that's an old wives' tale because I've never heard that before in my life. But that does bring up the subject of core vaccines may be considered different depending on what area of the United States or wherever you live. So like here, leptospirosis, I don't know that it's really considered a core vaccine. But like somewhere up north where it's more common to run into it, it might be. So do dew claws really save a dog from venomous snake bite, or at least buy them more time before treatment is required? No, babe.
Yeah, no, man.
No, it'd be
Fine.
cute.
Well, that is actually an old wives' tale.
Okay. I mean, no. Do they have to be front dew claws or back?
Oh, they didn't specify in their question, but I think to be safe, it should be all 4 dew claws.
Yeah. Just make sure your dog,
Claws or no dice.
just make sure your dog grows them or have them implanted.
But don't want to be part of an implanted dew claw.
I don't either.
Before I get into this review, I was also thinking, I know a way to make your life better.
Okay.
All you need is a shot of vitamin me.
I knew. That's why I paused so dramatically, because you get this look on your face when you're about to say something like that, and I just knew.
Well,
I just knew.
this was founded, I guess, the apprehension coming between this. So my review is that I'm real sorry I do this to you.
No, you're not.
I feel like one of these days they want to work on you. Then we'll see how it goes from there. So this is a VIP pet care, which I think it's a sister product to one of the bigger box stores, I think. But a 1-star review. Now, this is a trend. I have 2 reviews, and I also have a picture that I'm going to show you. We'll put the picture on the Facebook just so you guys can see where we're going with this. But we'll start with this one just so you guys can get warmed up for what's going on at this place. 1 star. Please train the staff. This is the review. And this is from, we'll go T-Top. T-Top says, please train the staff. They can't properly administer vaccine. Can't tell the difference between a flea and a fly. I've noticed a thread in underperformance.
Is that a flea or a fly? I'm not sure. It's flying around, but sometimes the letters get mixed up.
You picture
A flea flying around?
that's a nightmare.
I would pen.
But number 2, let's say you get to the vet and you set Fluffykins. Fluffykins is now the name of T-Top's dog, I've decided.
Okay.
T-Top sets Fluffykins on the table and he's like, hey, I think that my dog has parasites or something. Could you check? And the vet tech is looking and they're like, well, I don't know. It could be a flea or it could be a fly. Touch it.
See what it does.
If it's a fly, then it's,
If it's a fly, it'll fly at you.
right.
If it's a
If it's a flea, it'll jump in your eye. I think I'm
directly in there.
going right for a headshot.
Gotcha.
And train your staff. They can't give vaccines or tell a flea from a fly.
A flea from a fly. Well, I'm happy to say we both know the difference between a flea and a fly.
We do. And so this leads me into the next 1-star review for this same place. And we're following kind of on the same bandwagon about, we might not know all the things. However, this one may not be entirely their fault. 1-star review from Sarah. Sarah says, vets aren't educated about special breeds. I have a Lykoi, Lykoi. It is a rare cat breed. And the vet said his skin or coat was really bad and refused to give him vaccines. I informed her he was a rare breed and he looks that way because he's supposed to. I checked him from head to toe when we got home. His skin was clear, and I've been told many times he looks very clean and healthy for his breed. I stood in line for 2 hours to be yelled at by the vet who knew nothing about this breed and then was refused treatment. About this breed of cat.
I mean, they kind of look like a werewolf.
And again, do you see where they think that the skin may actually may look bad? Because our veterinarians that we work for will also do the same. Like if they're having a real bad skin infection, they'll also choose to not vaccinate because they don't want to overdrive the immune system.
This says meet the LaCoy, better known as the werewolf cat. So I'm not far off. Okay, they're just like kind of different looking.
They do look like they have a really bad skin problem. They look like they got the alopecia.
Yeah, like they're okay. It's just for anyone. You should look it up for sure. But so they have a bald face, but like then they have some fur in some places. Some places, and then like they're like they just have bald patches,
and so right, and that's why I get where they're coming from with the vets. Like, I don't want to vaccinate you. You clearly got a bad skin problem, and this person's like, no, you just don't know things. I can see both point of view, especially because the person before that was like, they don't know the difference between fleas or flies here.
Yeah,
so
I could see just looking at this cat and not knowing anything about this breed, you'd be like, wow, he's got a really bad skin infection. Like, no, he's just supposed to be bald. This is a $3,000 cat, though.
That's, wow. $3,000 for a cat that looks like it has alopecia. No offense to anybody who owns these cats. If you got $3,000 to drop on that cat, like, go for it. You live your best life.
Wolf cat.
How do you feel about this?
I just feel like they're cute. I love them. I wonder what their personality's like.
Mm-hmm. I have a question for you as well.
Okay.
Do you know
the Muffin Man?
The Muffin Man. The Muffin Man. The Muffin Man. He lives on Drury Lane. Drury Lane. And that's a different man lives on Drury Lane. Why do anti-vaxxers hate vaccine jokes?
Why?
They never get them. However, I also want to apologize if that joke failed, but I also had decided it was worth a shot. There you go. Now do it too. They were rough because you don't seem like you enjoyed them nearly as much as I enjoyed saying them. Maybe there's some dads out there that really liked it.
You had that look on your face again.
Yeah, I wish I knew what that look was.
It's the, you're going to hate this look. So we're going to talk about each of the things in these vaccines. I'm going to briefly talk about non-core vaccines, but there's so many of them that I can't really keep up with all of them. But the first one we're going to talk about is rabies. So this is for dogs and cats. And like I said earlier, a lot of places in the United States require rabies vaccination for your pet. I know they do here. So not getting the rabies vaccine is breaking the law.
Breaking the law. Breaking the law. You bad. You bad. An Einstein? You're living on the side of things that I don't venture too often. You bad boy.
Anyway, so rabies, it's a disease caused by the rhabdovirus. It is spread through saliva and the nervous system, so like brain tissue. It's transmitted most commonly from bite wounds, so it can be spread by mammals, but like skunks, bats, foxes, raccoons, coyotes, etc., etc.
Oh, I like etc.
Yeah. So clinical signs include neurological signs, aggression, solitude-seeking, incoordination, and even paralysis. It is fatal once clinical signs are shown, so there is no treatment. It is a reportable disease.
Can you explain to me what a reportable disease means?
So a reportable disease is just a disease that is considered really, really bad. So like the rabies virus can be spread to humans. So you have to report it to like the CDC or something like that.
Center for Disease Control.
Yeah. Mm-hmm. You'd have to report it to the disease control people if your dog or cat or whatever has rabies. So, and it's really bad because the only way to test for rabies is to send off brain tissue. And you can only do that after the patient has passed away. Because just Google it. I'm not going to describe that. That's really, it's bad. It's big bad. It's big bad. So dogs and cats both required to have that vaccine. For cats, some companies do it differently where there's like a combination for this, a combination for that. But I'm going to discuss like what is common in this area. So FVRCP is the one that we use, which is a combination vaccine. So for cats, the FVRCP vaccine is a combination vaccine that includes feline viral rhinotracheitis and calicivirus. Clinical signs of these diseases are sneezing, ocular nasal discharge, and fever. Calicivirus and feline viral rhinotracheitis have very similar symptoms, but calicivirus can cause ulcers, oral ulcers. It is spread in oral and nasal secretions, but calicivirus can also be shed in the urine and the feces. This vaccine also protects against feline panleukopenia, which is in combination, of course. It's caused by a parvovirus. Clinical signs include fever, lethargy, anorexia, dehydration, vomiting, diarrhea, sudden death.
I just threw that one in there.
Low white blood cell count, which is leukopenia. It's very typical. It can be spread in feces and urine and most bodily secretions, and it can survive in the environment for up to a year. And fun fact, the test that you use to test for canine parvovirus, the SNAP test, can also be used with feces for panleukopenia, which is pretty nifty. So there's a non-core vaccine for cats, which is feline leukemia virus. It is spread through nasal secretions and saliva through mutual grooming, sharing food and water bowls, and biting. Clinical signs include immunosuppression, anemia, lymphoma, and a lot of times they have to test negative for FELV, feline leukemia, before you give the vaccine because it doesn't make sense to vaccinate them for something they already have. So it's good to make sure. It is a non-core vaccine because indoor cats aren't as susceptible to it because they don't really come in contact with other animals outside that have unknown vaccine status and unknown diseases and stuff like that.
I have a 1-star review for a veterinary hospital out of California. We will leave it anonymous, but the review is from Leslie, and it's 1 star. In all capital letters, Leslie says, "Do not come here! Exclamation mark, exclamation mark, exclamation mark. No matter what you do, don't come here. They are very rude, very disrespectful, and extremely unprofessional. If I could give them 0 stars, I would." And there's a list of a couple of numbers of why. Number 1, made an appointment at 3:30, did not take my pet to be seen until 4:30. Number 2, they did not want to give me my pet back until I paid, which was weird.
It's actually illegal, but...
Number 3, they gave my pet medication without consulting me. Number 4, the front desk girl told the vet assistant to ignore me when I asked about my pet and when it would be ready.
Sorry.
And those were his reasons.
He's like, when's my pet going to be? Ignore her.
Ignore Leslie. She's been here since 3:30.
Ignore her. We're going to keep her pet in the back until she gives us money. Could you imagine just like talking loudly, not even caring? Just ignore her. She can't hear you.
Ignore Leslie. She hasn't paid for her pet yet. And she's been standing here for hours.
It's really, honestly, truly hard to make and please everybody. Like, I think that we work at a really awesome vet, and even we probably have some bad reviews too. Mm-hmm. So, like, people are just like, I don't know if this lady was just, I don't know.
I think my honest favorite part is that the receptionist is like, ignore her. Like, what were you doing in the meantime to make it get to that point? We don't hear the other side of the story also, but I'm trying to look at it in the point of view of the receptionist. And they're like, oh my God, Leslie is at the counter again, girl. Just, and the other one's like, ignore her. That's what I've been doing. She just nudges her. Leslie, like, thinks she might be a ghost now. I mean, like, they just do not see me. I've been here for hours and they just keep looking over me.
That's crazy. That I couldn't imagine, but maybe that did happen, you know?
Maybe it did. There's never a good reason to drop all of your customer service training because once you hit that level, there's no coming back from that. And it's really not worth it. It's better to ignore them, but don't tell them you're ignoring them. No, that's not the answer. Whatever you do, don't put your hand up and give them like the talk to the hand.
Yeah, don't wave them off.
Don't wave them up. They tend to not be crazy about that.
Like those videos that you like watch for like good like customer service, and they're like, pick which one's a good customer service. And the one lady's like, yeah, you're welcome, absolutely. The other lady's like, go and buzz off. What? You're like, clearly the buzz off was the bad one.
Right. Did you by chance come in while they were filming one of these videos and you just got the raw end of the deal? They were like, okay, now with this customer, we need you to do the bad ending. We need the bare minimum, babe. They just he didn't read his handout that was like, we'll be filming a series for customer service. And, you know, because a lot of times they don't read the handouts we send out anyway. And so he's completely confused.
He's like, buddy was so rude.
Buddy, you were in a video.
Honestly, though, waiting an hour for a vet visit, like, not that bad because I worked in ER and we've told people there's a 12-hour wait before. And they were like, okay.
And you never know, especially if it's a place that does general practice and sees emergencies. If that emergency comes in, that doctor is honestly doing their best to like save this emergency's life or whatever. But they also want to get to you. However, Snuffleupagus is going to be okay if he has to wait an extra hour for his rabies vaccine. I know your time is valuable and I know you have other things to do, but if you think about it as you're the one who has the pet there for an emergency and you're trying to save their life and this person's like, Snuffleupagus needs this rabies shot. It has been an hour. Like, what's up? Yeah. And I would also be like, just ignore him.
Just ignore him. They're doing CPR back there. So,
no, I just look around and pretend you don't see him.
Read the room, Jerry. Read the room. All right. So, for dogs, the rabies, like I said, is a core vaccine. The canine distemper virus and parvovirus, so DHPP, it has canine distemper virus in it. Clinical signs include decreased appetite, fever, lethargy, respiratory disease, vomiting, diarrhea, dehydration. Neurological signs such as seizures, ataxia, which is a wobbly gait, paresis, and hyperesthesia, which is like, whoa, what that? The virus is shed in all secretions, but commonly it's through respiratory exudates. So that's a bad one. You don't want that.
No, I'll pass into.
Canine adenovirus type 2 is also in the combination vaccine. It is one of the causes of canine infectious tracheobronchitis. One of the causes of kennel cough, essentially. Canine adenovirus type 1 can cause hepatitis. Can't vaccinate for this because the vaccine has severe side effects, so that wasn't like a thing. They're like, maybe we shouldn't. So they made one for CAV2. The dogs that do receive the vaccine for CAV2 are also protected from CAV1. So it works both ways. But clinical signs include vomiting, diarrhea, abdominal pain, clotting disorders, fever, acute death in puppies. Ocular signs such as edema can also occur in dogs recovering from the disease. So also, very bad. The next one is canine parvovirus. So parvo, dun, dun, dun. It is very serious and it's highly contagious. The virus can be shed and carried on clothing and shoes. It can also be shed in feces, so oral fecal transmission. So
That is probably one of the grossest things you've said so far.
let's eat that poop.
I'll pass. But
So like, say you step in dog poop and it has parvo in it, but you wipe off your foot, but you don't like disinfect it, and you walk into your house, then like your dog can contract parvo from that. So that's how contagious it is. The virus is resistant to many disinfectants and can survive in the environment for weeks to months. It can cause bloody diarrhea and dehydration. It can cause leukopenia, which is low white blood cell count, fever. Parvo is really bad because it can cause sloughing of the intestinal wall, which means like the skin comes off, like the mucosa. It prevents absorption of nutrients. It makes the pet susceptible to infection, and it's what causes the bloody diarrhea. And it causes a low white blood cell count, so they're unable to like fight back against the infection. It's more common in puppies who are unvaccinated, and they don't have the antibodies for it, so they can't fight it off. So it can be fatal. So this is probably one of the more important aspects of this combination vaccine is parvo. Then the last one is canine parainfluenza virus. It causes infectious tracheobronchitis, aka kennel cough, but it is a self-limiting cough, which is typically non-productive. There are a couple of non-core ones. They're important, but they're not, like I said, as, hey, you should get this.
They're lifestyle based.
So you might be offered the leptospirosis vaccine by your veterinarian. Leptospirosis is caused by a bacteria. It's transmitted through contaminated water, food, bedding, bite wounds, direct contact with an infected urine. It can cause fever, anorexia, peeing a lot, drinking a lot, vomiting. It can cause renal failure and liver disease. It is zoonotic, so it can be spread to humans. So we recommend it for like animals at risk for contracting disease based on prevalence of disease in the area. Like I said, here it's not as common. It can happen. I feel like up north, maybe it's a little more common. So it might be a core vaccine up there. Let us know if you're listening from up north. So like working dogs, hiking dogs, stuff like that, it's recommended for. There's also Bordetella.
This is the Bordetella vaccine, please.
Bordetella.
We've heard a lot of different versions.
Bordetella is the primary cause of canine infectious tracheobronchitis, which is kennel cough. So dry, honking cough, nasal discharge. Why are you laughing?
The word honking cough.
Honking cough.
It's not funny. I'm sorry. I'm childish.
So it's considered non-core because it's like if your dog is a little dog that goes and gets groomed, or if you go to boarding facilities a lot, then this would be recommended. Dog parks, things like that. So,
that one is fun because there's multiple ways it's administered, right?
yeah, you can do, I think there's one, like a nasal one that you can do.
I have always not been a big fan of that one just because it's like you're waterboarding this dog. And that might not be what waterboarding is. I'm not up to date with like torture techniques, but it feel like shoving some vaccine in the dog's nose.
I would want it in the nose.
I definitely would rather the other one, which is orally.
Yeah. There's an oral one, which is what we use. It just has to touch the mucous membranes to be effective. So we use the oral one at our vet, but
We have injectable. There's injectable.
yeah, there's injectable too.
That's for the
bad boys.
Yeah. If you don't really want to let us up in, oh, I was going to say let us in your mouth, but let us in your mouth open wide. But if you're not going to let us access those oral mucous membranes, we're coming in for an injection. This is a 1-star for a veterinarian in California. I am not sure if the vet here knows what he's doing. I took my Lhasa Apso since the groomer noticed that he had pain in his ears. When I got to the vet, he starts acting like the dog is going to die. He stated he's going to lose his ear. He needed to do some tests to the labs. That's a weird sentence. They worded it wrong. I think there's words missing. He ended up charging $500. I didn't feel comfortable, and I told the dog, I told the dog to the regular doctor. I think that's supposed to be took.
Yeah.
He charged less and said he had a common ear infection. I even asked if he was close to losing his ear, and the regular vet said he'd seen a lot worse, and even those dogs still had their ears.
They're dead. He was like, you gotta cut his ear off. That's the only option.
I wonder if he was joking, like he was trying to be funny and she didn't get it. She was like, I took him in for an ear infection, and the vet acted like he was about to die and said he was going to lose an ear.
We gotta cut it off. That's the only way.
Hey, I think my dog has a tick. That's a nipple.
Well,
He's gotta go. He's gotta go.
cut his leg off.
I know it's not exactly the same thing, but it feels like we're in the same vein of things here. It feels like a bit of an overreaction. And she was so worried that she went another vet afterwards and she was like, is he gonna lose his ear?
Could you imagine if someone was like, he told me he had to cut his ear off and it was just an ear infection?
I think I didn't get his humor.
Maybe he was joking.
I feel like he was joking.
He was like, well, we gotta cut it off. It's an ear. And she was like, oh my God.
He doesn't get, is satire what you would call that type of humor? Maybe?
Dry humor.
Like, babe, I think you missed it.
You missed the mark there. Kid.
Valerie, how's his ears now?
Don't cut them off.
Is there still two? Did he mean that you should have trimmed your Lhasa Apso's hair off his ears? Like, maybe they were real mad at him.
I genuinely think he was like, well, gotta cut it off.
He like pulled out the garden shears and he's like, here we go. Lopping it off.
I think he was joking.
Terrifying.
She took it seriously.
So scary. I don't know what's the worst. Like your vet joking that he's going to amputate your ear right in front of you right now with nail trimmers. I don't know if he might not have seen it, but you know, those things be sharp.
They do be sharp.
Or like he was serious. Either one just feels like a vet visit that you would talk about for a while.
Yeah.
What do you think the other vet said? What do you think the other vet said when she came in? She's like, was he about to lose his ear? Was he like,
he's probably professional about it. He's probably, no, it's the ear infection.
oh, baby, ear infection.
Not a
I've seen worse. They still have their ears.
all two of them.
All two.
All two ears.
Girl, keep up with that. Brush the ears, clean them out. This is a Reddit thread about what actually happens to your pet when you're at the vet. And it is a story of, I'm going to synopsize this story real quick. So this man brought his Yorkie puppy to a vet, and he heard the technician in the back like singing and having a good time and peeked around, and the lady's like back there dancing and playing with his puppy. And she was like, this is what the post is like, basically, this is what's actually happening behind the scenes when they take your dog to the back. And a vet tech answered under this comment, actually, though we do get to sometimes see cute puppies, the suicide rate for the profession is really high, and you're kind of making it seem like it's not as serious of an issue in the profession or whatever. And she's like, because really we have to euthanize animals too, and it's worse. And and they said, so the highest reasons for suicide in the profession is pet euthanasia and the pet parents. And this man called Clumsy responded, so basically the same as pediatricians. Now hear him out, because he's trying to make a connection here. Kids are the reason why they love their job. Parents are the reason why they hate them. And then someone responds to him and says, as a pediatrician myself, I can tell you that euthanasia is not all a positive event. Sometimes it's not even necessary, but we do it anyway. It's like a weird thread that I went down, and somehow it went from mental health in the veterinary community to being about pediatricians and how it's not always positive when they have to euthanize, but they do it anyway.
Well, this one's gotta go. Goodbye, Jimmy.
Did they find him?
They found him bit up by ants, and they were like, gotta go.
Time. I just thought it was the crazy thing to try to make that correlation. and make it once again about people doctors. But whatever. That's a whole tangent on a whole different thing. I really needed to share that there's a pediatrician out there that we need to be checking for.
Yeah, it sounds like some sketchy things are happening.
If he is automatically like,
gotta go, kid.
Go, it may not be the pediatrician for you.
He's a screamer, gotta.
Yeah. Okay, that reminds me of a personal story. When I was in middle school and I had to get vaccines, this may be strange news to all of you, but I had a very terrible fear of needles. And I'm afraid of needles too. As a middle schooler, you have to get vaccines to go to school. I don't know about today. This was like 700 years ago. And so we are at the pediatrician, I guess is where you go to and as a middle schooler. And my aunt brought my mom because we had just moved down here and we didn't know our way around. And they took me to the back to get my vaccines, and I threw a fit. I was screaming. Middle school? I was screaming. You could hear me out in the lobby. I was scaring the other kids that were there. And they brought in this big man nurse, and he put me in his lap and like put me in like this bear hold thing to get my vaccines. And so I was kicking anybody who came near me with my feet. So on my feet. And my aunt actually like left the building because she was so embarrassed to hear like me in there. And you gotta think, she was the one who recommended this place, right? And now, because she brought her kids here too. And then she's like, let me bring my niece. And then I did that. And then they asked us not to come back anymore. We had to find a new doctor. And my mom was really mad.
Oh my gosh. Girl, why would you do that?
I was a kid and I didn't want the vaccines. And the best way in their eyes was to have a big man hold me down and make me get them. I still don't think I'm the biggest fan, and that might have added to it.
That is crazy. That is wild. He was like, well, how did he just grabbed you? Like,
I don't remember how it happened exactly because it was so long ago, but I just know I wound up in this guy's lap being like held in a bear hug.
You didn't think when he came near you that like maybe you should run?
I've never been to back to like stranger. Here's not to go bear. Here's a bit of that. And like these people chasing me through the parking lot, that would have made it worse.
That's awful.
My mom was like, get in his lap.
Just sit down and go.
Sit in his lap, honey. Trust me. And then I get in the lap and he's like, oh. But I wish I could remember the details of how I wound up in his lap.
Okay.
I seem to have blocked it out.
Trauma. You traumatized up again.
It was a relevant story about vaccines.
Well, that is the nice out. That would have been, you would have had the one
in the case for it.
Yeah, I agree. Absolutely. Okay, well, maybe little antihistamine before you go.
Let me get some gabapentin on board ahead and die.
Shoot it in your mouth. All right. So, like I said, there are many different non-core vaccines, like the rattlesnake vaccine, Lyme vaccine, influenza. So you just talk to your vet about which vaccines are relevant for your pet and then go from there. Lyme disease, it is caused by the bacterium Borrelia burgdorferi. It is spread by ticks. It can cause fever and polyarthritis, and it can even cause renal failure. It is considered non-core because it's only for dogs in areas with high risk of exposure. Use tick control. Prevention! Okay, so I can't talk about all of the different vaccines, but I talked about the ones that were most common that your vet's going to be like, hey, you should know this. So there can be some pets that have adverse vaccine reactions, side effects. Most of them are mild and non-threatening, not life-threatening. Lethargy, mild fever, soreness at the injection site, decreased appetite. If it lasts longer than 2 or 3 days, contact your veterinarian. And sometimes with nasal vaccines, a small percentage of animals can develop like mild upper respiratory things like sneezing or coughing. But there is the possibility of allergic reaction. So facial swelling, difficulty breathing, vomiting, hives, diarrhea, things like that. So if you're going to see it relatively quickly within the first like 30 minutes to an hour of administration, but contact your vet immediately because sometimes your pet needs like an injectable antihistamine or a steroid, depending on doctor preference. And sometimes your pet just may be one of those that needs an antihistamine before receiving a vaccine in the future. Rarely, there can be, typically in cats, a mass that can appear at injection site. It's very uncommon, but it can happen. And sometimes it needs removal. But if that happens, check with your vet, have them take a look-see at it. Make sure.
But is that why we try to, with veterinarians in Texas, that way we're putting our vaccines in limbs instead of the way it used to be like up in the like shoulder area and stuff like that. Now we're kind of focusing on like a hind limb type deal.
Yeah, lower limb, I guess. It's easier to remove a mass in that area than it would be like up somewhere else. So a lot of the times we'll put the vaccines in specific areas because there can sometimes be masses that develop. So I know it sounds scary to be like, oh no, my cat's going to get a mass if I get this vaccine. But it's considered very rare. And the protection afforded by immunization outweighs the small potential risk of an adverse event, like the things listed above. So we get more. Of course, anytime with anything, there's a possibility of something happening with anything in life. But the benefit outweighs the risk, I guess, is what I'm saying. So this changes depending on veterinarian, but most dogs and cats start their vaccines at 6 to 8 weeks of age, and they get them every 3 to 4 weeks until 16 weeks of age. And then at 16 weeks at our vet, we'll do the rabies vaccine. And then typically revaccination happens yearly, but there are like 3-year vaccines that exist, like with the rabies vaccine and stuff like that. And then most vaccines given for the first time have to be boosted, like the leptospirosis vaccine has to be boosted. But you can talk to your vet about that and they will send you down the right path on vaccine schedule. But prevention is key. So preventing things before they happen is important.
It did sound scary when you mentioned the possibility of the mass, which is really rare to happen. The fact that the dog might feel a little crummy for a day or two. None of that equals up to what would happen if that unvaccinated cat got you in your face. And now you have to go through a series of rabies vaccines, and that cat is going to have to be sent off for like rabies testing, which we told you we weren't going to discuss how that is. Yeah, you don't want to know. It doesn't go well for the cat.
Yeah, because like if your animal is not vaccinated for rabies and it bites somebody, then there's like there's a fine you have to pay and like a fee you have to pay, and like you have to quarantine your animal, and it's just not worth it.
And if it's a stray animal, they get sent away for testing.
Yeah. Okay. That's all I have. Do you want to end on something funny?
Yes, I do. This is a 3-star review by Duncan. Have I used Duncan before?
No.
Okay. It is a veterinary hospital in Australia, and Duncan says 3 stars. He's a local guide over there. Duncan, show us around Australia. You're a local, right? Yeah. I heard a lot of things there don't want you there, like spiders, snakes.
I hear they're real big.
Yeah.
And scary.
Duncan says, I really like vet doctors, but reception girl, very rude. I understand that no one person can't all the time smiling and give good service. I don't know this girl name, but when I press the bell, she's just shouting from reception, "You don't see? I'm talking by phone." I prefer she just ask me to wait or just ask how she can help. But no, nobody opened the door because of COVID-19. So another 10-minute, I just left car park. Really sad.
Really sad. Big sad. Not happy.
How many times do you think he was ringing that bell? And she's like, "Can't you see it on the phone?"
Honestly, if someone like was standing in front of me and they're like, ding, 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 I would probably react. I don't know.
Again, with that thing where we're like, maybe be more cautious with your, people skills. But how many times do you ring that bell for real? Being honest, because someone is sitting there constantly pushing the bell. I might also be like, just ignore him. He's been there for.
Just ignore him. We're gonna keep his pet forever.
We're not gonna let him in. Yeah, he liked Vet Doctor though.
Like Vet Doctor. Hate reception. Big sad.
There was a lot of words I think missing out of the review.
Much anger. 1 star.
I do have one more review for the same place. This one is Randy.
Good old Randy.
So this is Australia as well. It's a 1 star. The names in this review have been changed for anonymity purposes. Anonymity and enemy. This is Randy. 1 star review for the Australian veterinary clinic. Shockingly bad experience. Dr. Shanamana is the most arrogant vet we have ever met. The young receptionist was a lot more professional, so 1 star is for her. You, for just future reference, you couldn't have gone less than the 1 star anyway. So he's like, this is a 1 star review, but that is for the receptionist.
Actually, it's 0 stars. I just had to give a star so she can have it.
Don't ever take your pet here. Try elsewhere first. They respond, Dr. Shanamana personally. I understand you disliking me. And then the name is different from the one who left the review. I understand you disliking me, Nathan. But you...
Who's this person?
But you are the electrician.
Oh.
Not a client. And did a rather poor job on installing the lights, which cost the hospital a lot of money to rectify.
He said he's a terrible vet. You're the electrician, sir.
There were live wires left on the roof. I also don't think it's very professional to have set up a fake account to leave a review. I will not be doing the same back to you. I'm grateful, however, you didn't trash any of our caring and big-hearted receptionists. If you ever have a pet, we'd be glad to care for them. We paid your invoice in good grace. We wish you all the best. Warm regards.
Warm regards.
So it's not. See, Dr. Shanamana, good for you. Did I change her name?
Yes. No. Yes.
Was it always Shanamana, or did I add more syllables?
I think it's Shanamana.
Okay. Yeah. Good for you. And also, shame on you, Randy/Nathan, the electrician. They are so rude there, and she is the worst vet I ever met. Sir, you left live wires on our roof. Could you stop?
Ma'am, this is Kmart.
The lady in the shoe department was very rude.
This is a dog park. I love it.
I don't get it. I honestly, the things that goes to people. We paid your invoice out of good grace. Be thankful you got your money. You left live wires on the roof.
Warm regard.
And then we're gonna end it with a couple of great classic movies. I just got a little review just so you can understand a little better about rabies. This one is Old Yeller, 1957 movie. This is by Barry. Is the 1 star. I thought it was very unrealistic. I mean, they could have eaten a dog or even made a sweater out of his skin. All in all, I think this movie was garbage.
Make a sweater out of his skin?
Barry, don't eat the dog that contracted rabies.
Don't do that.
I know that is also how you get rabies.
Yeah. Don't eat
the bad idea.
Don't eat his brain. That's bad.
Y'all check on Barry. I'm scared for him.
He probably has rabies. He probably wrote that because he has rabies.
Yes. And this one is a 1-star review for Cujo. Is it a horror movie? Are you familiar with Cujo? Okay. This is a 1-star review by Ethan. Mm-hmm. Oof. 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 Dog rip scorpion.
Get over here.
Oof. Exclamation mark. The dog is dead because Scorpion said, get over here.
I'm so...
What?
Oof. Ooh. There's like 20 explanations. Right? What in the world?
Okay, so I think when he's like, Scorpion, get over here, I feel like that's a very Mortal Kombat thing. Maybe he was talking about, like when his flight comes out of his belly and he's like, get over here. Maybe that is, I got that vibe off of that, but also, what does that have to do with Cujo?
That's crazy. What am I going to say next?
Different varying levels of O.
Okay, yeah. We love that.
We do love
that. I feel like maybe he was reviewing the wrong movie.
Like the Scorpion King or something like that, because he mentioned a scorpion in it.
But then he said dog, so it brought me back. But
Scorpion King has a dog in it?
I don't know.
Was he reviewing the Mortal Kombat movie? I don't know what's happening.
That guy was...
Y'all be careful out there.
Be careful. There's some people out there. All right, well...
Want to plug some of our socials?
Yeah.
We are now on Pet Life Radio.
Okay, so we are on Pet Life Radio now, which is fantastic. To listen to us on Pet Life Radio, you go to petliferadio.com.
Yeah, and actually there's access to our podcast on other different platforms from their website.
Yes.
And we have an email that you can reach out to us. It is
talkpetswithus@gmail.com. We're very excited about that.
Yep.
So we're on Spotify, we're on Amazon Music, we're on Apple Podcasts. We're everywhere. You have no excuse.
But share us. We want to get in everybody's ears.
We have a Facebook page, Let's Talk About Pets. You can find us there on facebook.com.
If you find any reviews or bad advice online, send it to us. We need your content as well. You guys are our boots on the ground, if you will.
Yep.
And also we're going to end this with an AI song made by Suno.com. Nice. And if you guys want a free version of the song, reach out to us and it can be sent to you as an MP3.
Okie dokie. Well, y'all stay safe out there. We'll see you next time.
Get your pets ready to go. Safety first, don't you know? Little poke makes it right. Keep them safe through the night. Vaccinate, vaccinate. Let's all say, keep the dangers far away. Protect your pet night and day. Vaccinate, it's the way. Lethargy, little rest. It's just a phase. Do your best. Better safe than sorry. Friend from rabies bite we defend. Vaccinate, vaccinate. Feel the beat. Keep those paws on their feet. Smart and safe, it feels so neat. Vaccinate, it's so sweet. Ooh yeah, lost the guy. Do it right for your pets. Hold tight. Rabbit cat won't scare you then. With the shot, you'll win it again. Vaccinate, it's the call. Protect them one and all. Rabies free, we stand tall. Vaccinate, let's have a ball. Lethargy, little rest. It's just a phase. Do your best. Better safe than sorry. Friend from rabies bite we defend. Vaccinate, vaccinate. Feel the beat. Keep those paws on their feet. Smart and safe, it feels so neat. Vaccinate, it's so sweet. Ooh yeah, lost a guy. Do it right for your pets. Hold tight. Rabbit cat won't scare you then. With the shot, you'll win it again.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.